Removal of unabsorbed poison from the body. Inhaled poisons. In cases of inhaled poisons, carbon monoxide, hydrogen sulfide, chloride, fresh air. Remove patient into fresh air, first of all. Air passages, clear air passages. Mucus by postal drainage or aspiration. Endotracheal intubation. If necessary, artificial respiration and oxygen 6 to 8 liter per minute. If bronchospasm is present, acid irritant gases, aminophylline 250 to 300 milligram, slow IV, inhaled beta to agonist, oral or parenteral corticosteroids, diuretic if pulmonary edema is threatening, monitor for respiratory distress. If a cough or a breathing difficulty in breathing develops, evaluate respiratory tract irritation, bronchitis or pneumonitis. Injected poisons. Case of ingested poisons, insect or snake bite, scorpion bite, drug abuse, nitrogenic infections, reassurance, calm the patient, reassure, sedative may record, ABCDE. Monitoring patients, ABC, shock, treat shock. Allergy, observe patient for allergic reaction, treat anaphylactic reaction on standard lines, remove sting. In cases of bee, wasp, scorpion or centipede, local vasoconstrictions, adrenal injection around the injected area, apply ice locally or immerse injected part finger, etc. in cold water 10 degrees Celsius. Tight ligature. Above the injection site, wound excision, sucking out poisoning with a local utilization of poison with a suitable chemical are no recommended. Next is contact poisons. Eye contact, irrigate exposure eye with a copious amount of room temperature water for at least 15 minutes. Remove contact lens if present. Skin. Remove contaminated clothing and wash exposure area thoroughly with soap and water for about 30 minutes. Same procedure if poison applied to wound or inserted into bladder, rectum or vagina, remove jewelry if present. Next is ingested poisons. Emesis. An emesis is a substance that induces vomiting when administered orally or by injection. Emesis is a virtually obsolete now, may come in handy when nothing is available. Salient features when used. There is difficulty in obtaining or using stomach tube. If vomiting center is still function responsive to emetic position during induction, the person must either be sitting or a lying position on his side, which the side head dependent, otherwise there is danger of inhaling gastric under. Mechanically induced if tickling brought to a patient on fingers, doctor's fingers, feather, spoon handle, wooden tongue, depressor usually ineffective. Pharmacology induced all emetics considered obsolete by many authorities. Last to fall out of favor was IPAC 1990s. Many others, however, continue to use it for this reason. Emetics find mention in subsequent. IPAC. Root of a small shrub, Cephalis Ipan canugua, native to Brazil. In India, grows in West Bengal. Preparation Ipacanua powder 1 to 2 gram. Okay, 1 to 2 gram Ipacuna. Dose of syrup of icabinum with 30 ml. An adult 50 ml in children. 10 ml, 5 ml administer several glasses of water afterward. Induces vomiting 90 to 95 cases within 30 minutes. Dose is repeated if vomiting does not occur at this time. Active principle: cephalin, emetin, psychotrine are the active principles as a mechanism. Central stimulation of the vomiting center, peripheral stimulation of the sensory receptors. In GAT, current status, although very popular to the final years of 20th, more recommended reason. No evidence of any clinical benefit. Poison removed is highly variable in quantity. Variable in quantity, which diminishes with time. Reduces reduces effectiveness of established and useful therapies. Activated charcoal oral antidote. Uh, Oral antidote whole bowel irrigation. Adverse effect cardiac toxicity. The complication of emesis may be harm if administered a patient who has decreased level or impeding loss of consciousness. Abuse by bulimics. Munchausen syndrome per proxy. Observed since long. Apomorphine not effective orally. Must be given parenterally copper sulfate. Hand wash in liquid detergent its use was reckoned only when the time was crucial. Nothing else was available. Mustard water. Saturated solution of common salt causes of fatal hypernatremia. Tartar emetic zinc sulfate. Contraindication. Same as those of gastric lavage. Example hydrocarbon. Have a high aspiration potential corrosives. Active or prior vomiting, nicotine. Ingestion that can alter mental status, coma. Exposure to toxin with a more pulmonary toxicity from inhalation than toxicity from a GI absorption. Example hydrocarbon. Poisons inducing seizures. Poison inducing seizures. Tricyclic antidepressants. Emesis is contraindicated, although gastric lavage may be done if need for advanced life support within a 10 to 60 minutes. Anticipated deliberate elderly patients. Medical condition that further compromise by induction of emesis, heart disease, pregnancy. Adverse effect that is aspiration, Borges syndrome, esophageal rupture, coma, intractable vomiting. Mallory syndrome leading from tears in the mucosa at the junction of the stomach and esophagus and a seizure. Thank you.